Good afternoon, dear doctors and friends. Today, allow us, the SGD B7 group, to present the results of our student project with the theme of challenging Osce in new normal era. First of all, let us introduce ourselves. My name is Nadia Ernestine Sembiring Depari with my last 3 digits of student number 155. Almost 3 years have passed since the COVID-19 pandemic first appeared, and we were forced to adapt in a very short time. Of all aspects in life affected by COVID-19, the education sector experienced one of the hardest hit. Since we have to practice social distancing, the process of offline learning has shifted to online learning. Online learning has been a challenge for all students, including medical students. In medical school, we know Osce, or Objective Structured Clinical Examination, as an assessment that measures student clinical competence by rotating them through multiple stations. Resulting from a research that had been done to third-year students at medical school of Tübingen, students agreed that the Osce is even more challenging. This pandemic affected the clinical and communication skill examination during Osce. Based on the written background, the authors are going to gather and review various information regarding challenging Osce in the new normal era. This paper will hopefully help medical students to meet their learning requirements to attend a face-to-face class under contemporary pandemic conditions.
Good afternoon, I'm Philbert Purbowo, and the last 3 digits of my student ID are 148. For our student project, we have 3 problem formulations, which are, first of all, what is Osce? Second, how is Osce different during, before, and after the COVID-19 pandemic? And third, what are the challenges encountered in Osce during the COVID-19 pandemic? For the objectives, we also have 3 of them, which are, first of all, to understand the definition of Osce. Second, to identify and compare the differences between Osce before, during, and after the COVID-19 pandemic. And third, to identify and analyze the challenges encountered in Osce during the pandemic from various aspects.
My name is Putu Prameswari with the last 3 digits of my student number are 151. I will explain about the benefit on writing these student projects. The general purpose is to analyze about the Osce challenge before the pandemic, during the pandemic, and after the pandemic. The specific purpose is to decide whether or not there is a difference in student performance in this new normal era. And another benefit is to raise awareness about Osce exam challenge in this period.
My name is Prabha Dewi with the last 3 digits of my student numbers are 146. Osce is a form of examination, which medical students interact with a series of simulated patients in stations that may involve history taking, physical examination, counseling, or patient management. Doctors Harden and Gleason proposed the Objective Structured Clinical Examination, or Osce, in medical school as a form of overcoming problems from conventional clinical skills assessments and improving the quality of the clinical performance of the medical students. Harden's primary aim was to standardize the exam, avoid subjectivity related to the examiner, and add objectification to assessment of clinical skills. Osce can be divided into 2 categories, local level Osce and national level Osce. Local level Osce mostly held by the end of the year or the semester, depends on each medical school policy and procedure. National level Osce held simultaneously by all medical schools with the same procedure.
Evaluation of Osce method. Around the world, Osce is globally utilized more frequently in diverse scientific specialties for both formative and summative evaluation. Osce is proven to enable students develop into self-directed learners and have begun to think critically and learn deeply. Although there is a lot of benefit over, it has been shown that the students find the process is very difficult, time-consuming, and stressful.
Good evening, my name is Kenisha Tedijanto and the last 3 digits of my student number is 154, and I'm going to be talking about the comparison of method of Osce in normal era, online era, and new normal era. During the normal situation, Osce examinations uses Osce stations where each student would have to take turns to perform different clinical skills under a timer in each station. For example, Station 1 is for cardiovascular examination, then Station 2 is for acute asthma examination, and the features that may be assessed from the students could be their skills of history taking of patients, methods of obtaining clinical proof and response to unpredictable patient conditions, and management plan of the patients. In the previous online era, students practiced with their own tools at home. Many of them used online simulations in websites and applications. For instance, the evaluator needs to make sure that students do the examination by themselves by checking their environment with cameras. And they would have to use mannequins instead of real humans. The evaluator watches the students with online meeting platforms, and students have to record the environment 360 degrees with their cameras and report it to the evaluator. In the new normal era, students are watched by evaluators directly while also applying some protocols like sanitizing and applying social distancing. Thank you.
Hello, my name is Nesa Aini with the last 3-digit student number 156. I will explain about the student performance comparison. In normal era, the student went through Osce face-to-face, and they usually go to the campus to attend the Osce. And in online era, they went through online Osce from home. And in your normal era, that hybrid, they went through online Osce or offline Osce depended by the situation in their region. The preparation for Osce is better in offline Osce because they feel watched directly by the evaluator. In online era, students spend more time at home that influence their psyche.
My name is Jacinda Isadora Mannuela Simanjuntak with the last 3 digits of my student's number 147. In this new normal era, many schools and universities are returning to continue their offline education. Specifically, for medical students, there is a practical-based exam called Osce. In this new normal situation, the provision of materials and the Osce exam can be done face-to-face. A few days before the Osce exam, students get used studying together with their small groups to prepare for the Osce exam. One of the challenges is how not to get infected with the COVID-19 virus while they are studying together and not become Oleh in the chain of the spread of the COVID-19 virus. Many students think the Osce is more stressful and intimidating than other kinds of tests. Uncontrolled stress can disrupt the demonstration of the students' competence and disrupt the Osce validity. Furthermore, students have to mentally prepare and calm themselves when they meet face-to-face with the examining doctor.
Good morning, good afternoon, and good evening, doctors and dear friends. My name is Putu Dewi with the last 3 digits of student number is 159. So now I will explain the challenge of Osce in the normal era from the lecturer's perspective. So as we know, these past 2 years, Osce has been held online due to the COVID-19. But since the new normal era, many institutions have started to hold offline Osce. And this transition from online to offline has brought many difficulties and challenges, especially from the lecturer's perspective. The first one is the lecturers have to find a spacious place that is large enough for the student to do social distancing. And the second one is that lecturers have to provide hand sanitizer in every room, which will cost more money. And the third one is the lecturers have to make sure that the venue and the tools that will be used by the student have been sanitized before and after the students use it. And the last one is when the lecturers cannot find a spacious space, they have to divide the students into some small group with different Osce test time. And it will bring challenge since they have to make sure that the Osce time is adequate and do not pass the learning time in academic calendar. Thank you.
My name is Gusti Agung Krisania Mahaputri with the last 3 digits of my student number are 143. Next, themes that involve with Osce in new normal era. First, from the financial aspect. Osce itself is undoubtedly extortionate for medical school who utilize them. In new normal era, institutions cost more money to hold an Osce because institution and medical students need extra effort to protect themselves from the viruses. For example, they need to do the test and verify themselves when they got sick. Other prevention by implementing health protocols that the government had released, even if some of them have always been regulated in medical school, to achieve the objective of those protocols, the institution and even the medical students need more instrument and mechanism. Second, from the social aspect, medical students need to discuss with each other to understand and learn more for Osce preparation and post-Osce reflection by sharing information that they got. The point of communication here is to understand, and in order to understand the communication, people need two aspects, which is verbal communication and non-verbal communication. The limiting of physical distance and other health protocols complicate students to noticing non-verbal communication. Thank you.
My name is Kinan Kalisha with the last 3 digits of my student number are 152. I will continue with Krisania's explanations about the themes that get involved in new normal era. So the third aspect is mental. The pandemic itself already gave rise to a culture shock to most of the society. There are many new mechanisms with the limitation that appear because of health protocols that make some of them get desperate and have hard times. New normal purpose is to make people adapt with the happening condition, with making a behavior change to continue to carry out everyday activities with the implementation of health protocols to prevent the transmission of COVID-19. And the last aspect is physical. During the normal era, people's awareness of the importance of healthy behavior, enough nutrition, and physical activities have arisen. Osce in the new normal era helps arise awareness and prevention of any possible disease. Students and the facilitator must have gotten their vaccine and proper body condition. Thank you.
My name is Skylenn Hertanto Tan with the last 3 digits of my student number is 145, and today I will explain about the solution in facing the challenge of Osce exams in the new normal era. So what is the solution? In general, the solution to overcome the challenge of running Osce exam in the new normal era is by running the new normal health protocol that we have already implemented in our daily life, where the new normal health protocol has already been proven to reduce the risk of COVID-19 infections while maintaining public productivity. This health protocol includes always wearing face masks, frequent hand washing, temperature check before entering the venue, and much more. There must also be an appropriate place for the examination to be able to perform social distancing from each other. And besides that, examiners and students must report if they have symptoms or has been exposed with a COVID-19 individual a few days earlier so they can be replaced with substitute examiners or find alternative solution for the test takers. Thank you.
My name is Putu Nadia Anandita Prasanthi and my last digit of my student number is 150. As conclusion, the Osce exam can be done face-to-face, which creates various challenges, such as how to not get infected with COVID-19 virus and not become a link in the change of the spread of COVID-19. Another challenge is making sure that everyone in the exam is regulated with health protocols to avoid more cluster. Moreover, students should be able to adjust from being online to offline and mentally prepared when they meet face-to-face with the examining doctor. Our advice is institutions should make certain adjustments besides wearing a mask, such as setting up a suitable location that can allow for sufficient separation of all participants and ensure that the rooms should be separate. Therefore, students and lecturers have to maximize the opportunity they have when doing Osce offline by setting up their learning environment so it will be adaptable for students. By the end of the presentation, we would like to thank you for listening and watching our video. We apologize if there's any misunderstanding or miscommunication during this presentation. Thank you.